last one last note before I send it over to Wei being a little bit behind schedule, which is another thing we heard from the last meeting was really this need to ensure that we're doing user user-informed end design process. I'm sure I'm muddling those terms with the idea that family voice should be central. We have several members of our work group who are representing that family voice.
You're okay, baby.
We also have the Family Voice Council that is being started at the Office of Early Childhood. And I spoke with my colleague Amanda Culbertson today, and we have reserved their time in October to be able to present some of our recommendations to them, present sort of the scenario of what a family would look like walking through the system as we've thought of it up to that point, and get their feedback. So just wanted to share that with you, and we'll have more information on that later. So I'll send it over now to Wei Bing.
Great, thanks, Kristen. So since we have some new folks on the call, I'll just do a super quick introduction. So I'm from the PDG B5 National TA Center. I have some colleagues of mine on the call with me, and we are supporting Kristen and Lindsay and Megan within your state to facilitate this group. We are also some of the staff who've worked with other states on their coordinated application eligibility and enrollment efforts. And so we have some perspectives to bring, I think, to your state based on what we've seen other folks do. And so today, this being the first of a series of content-oriented meetings, is going to be a high-level overview of CAEE. And so here's our agenda. We're going to start with an opening activity that we're hoping everyone will participate in. And it is, my colleague Carolina will give instructions in a minute when we get to it, but it's going to be a small group round robin. And so we'll break everyone into breakout rooms. And we'll come back together and talk a little bit about what came out of the groups. And then I'm going to spend some time doing this high level overview around what CAE is and what we see as different models that folks, different localities around the country use when they're trying to implement CAE, what people's motivations for doing it is. And so it may be information that's all very familiar to you, or it may not, but we are trying to just provide this overview so that we start this series of meetings off with a shared understanding. And so we'll move into more content, and then my colleague Carolina will join me and we'll talk about different considerations that we think are important for this group, or different topics that this group should consider as we move towards these recommendations that we all know is the end goal of this work group. And we'll share some examples of other states that we know are on this road of doing this work as well. We'll end with time, we'll have time for questions, and then we'll end with a closing activity using the Jamboard. So that's our agenda. Next slide, please. And our objectives for today, I started to touch on this already, is to develop this shared basic understanding of CAEE. I know folks in the room come from different places. Many of you are programmatic folks, and so you may have a really good understanding of enrollment processes as it is, but others may not. And so we just wanted to lay some groundwork so we're all approaching this with some similar understanding. And as I said earlier, we're going to identify the key issues and decision points that we think it's important for this group to consider as we move towards those recommendations. And each of the subsequent sessions after this session will be ones where we really hone in on particular topic areas. And so today it's just to kind of, introduce everything and get people thinking about what the important discussion points may be, and then we'll dive into depth later on. Okay, next slide, please. Oh, and I think this is back to you, Kristen,
Okay.
to revisit our norms before we start.
Yes. So these are the norms that identified from the last meeting, and we thought it was important to revisit these each meeting. So we're starting our discussion, reminding ourselves what we said we would hold one another and our own self accountable for. So again, just to highlight some of these key points, we really want to make sure we are putting children and families first in all we do. We're keeping that family focus. We're appreciating each other's passion, assuming good intentions, being creative and thinking outside of the box, being respectful, keeping an open mind at all times, staying engaged in what we're working on, understanding the differences in brain preference and personalities and how do we approach the work that we're doing. We're not going to let the enemy or the perfect be the enemy of the better. We're going to stay mindful of our own airtime and make sure we're giving people space to think and respond, and not and allow them to do that in multiple different ways. We're going to have regular check-ins to see if there's anything we can improve, listen to everyone's perspectives, and understand and acknowledge and be accountable for our own impact, and also to create and honor different ways of interacting and participating. We talked about that before, the different modalities of engaging. And just really, again, being brave and understanding that things can feel scary because they're unknown, but that we are going to go boldly forward with creative, open minds and respect for one another. So is there anything that you all feel wasn't captured from that last time that you want to add today? You can put it in the chat or say it out loud. Okay, just check the chat. I feel like this was comprehensive. So I think we'll move on in the agenda.
Thanks, Kristen. You can keep it there for a second. I know, oh no, in the next one with the title.
Thanks.
Yeah. Okay, so for our opening activity, so far we've engaged you through Jamboards, and now we're going to go into breakout groups. This is a little bit of a transparency and facilitation. I'm going to be waiting for Kristen's signal to tell me that the breakout groups are ready to go, but I will introduce this. So one of the reasons we wanted to get you all into rooms to at least have some smaller face-to-face time with each other, and hear where you all are coming from in terms of how CE works. So in your small groups, you will have one recorder or note taker that we've already identified, and that person can self-identify in the group once we get in. And each person will take a turn filling in this sentence. Kristen, can I get the next slide? The next, you should just hit click. Yep. Filling in from where I sit, your vantage point. Coordinated application, eligibility, and enrollment is a process where you fill in the blank, needs your blank in order to blank. And the reason, the why behind this is blank. So we're giving you all an opportunity from your vantage point to fill in these blanks about all of these different components and the reason. Kristen, are we almost there on breakout groups?
We are, I think. I am going to just double check. I apologize, you all. This is the first time I tried breakout groups in meets, and I had my expectation was not quite on point. So let me just everybody think about your sentence for one more second. Let me see if this works, and if it doesn't, we'll pivot. We'll do it whole group this time. And I will apologize and make sure I'm on it better next time.
Yeah, if you end up in a room by yourself, just know you should not be there and just come back to the main session. We'll try and figure that out.
And it looks like one person needs to stay in the main room. So Lindsay, I'm gonna make you do that. If I can move you, I don't think I can. Okay.
Everyone will have their sentences ready to go by the time.
That's right. I was going to say, if people could start thinking, that would be fantastic. And the recorder in each group will do the round robin, and we'll take down people's responses. Actually, the final piece to it is, before returning to the main room, we're hoping each group can select one or two of the complete responses from individuals that they feel speak to them, so choose one or two out of the 5 perhaps that each group will have, and share it back when we come back into the main room together.
Okay.
And then we're going to take everyone's responses and put them in word clouds, and hopefully by the end of the meeting we can share the word clouds with everyone so you can see collectively what our responses were. Learning
how to do this, just like when we build a coordinated application eligibility enrollment process. Thanks, Stacy, for your grace. Okay, now let's get back to work.
Okay, so I'd like to do a share out on groups. My group had 1 entry, so that is by default the one that resonated the most, but I'd like to hear from other groups. I have no idea now who was taking notes, so please self-identify and share one of your fill-in responses.
So I can start, Carolina. I ended up in a larger group. I think we had about 10 folks, and I hope everyone who wanted to contribute had an opportunity to. I did my best to record people's responses. And so we didn't have a chance to choose necessarily as a group, but I did notice that amongst the responses, there were some folks who used the state as the actor. It's a process where X, the state, and some folks used families or providers, or both families and providers. And so I was asked to share one sentence from each. So one is, from where I sit, CAEE is a process where Colorado, being the state, Okay, I'm going to try a different one. Sorry, my typing wasn't so great on that one. Where the state needs to coordinate our efforts in order to support families, and the reason to do this is so that families can access their early education needs.
Thanks, Wei Ming.
And then the one for, I'm going to choose one for family and providers. So CAE is a process where families and providers need to have an in-depth knowledge of the systems we put in place in order to have long-term success. It starts with the people on the ground.
Yeah, that communicating a complex system is definitely a challenge. Anybody else? Any other groups?
I can share from the group.
Yeah.
So we had a couple of different responses, but we pretty much worked together to create one that we were all happy with. So we came up with, from where I sit, CAEE is a process where collaboration and coordination on behalf of the state and partners needs to happen, needs to have the application process be simplified in order to best serve families. And the reason to do this is to help families more efficiently access the resources and supports that they need.
Thanks, Megan.
My group was, it's a process where funding and programs need to be blended or combined or merged or layered in order to maximize access to quality early childhood programs. The reason to do this is to expand families and children's support and access to good early childhood programs.
Thanks, Scott. Are there any other groups?
Yeah, we went a little rogue because we didn't have a note taker, but we got it. Something similar. The CAEE is a simple, easy, efficient, aligned, and understandable process where the burden is less on the family in order to give families access to services and supports.
Great. Thanks for going rogue and keeping with it. I appreciate that. Any other rogue alternative groups around here?
I can talk about what our group discussed. So we talked about how it's a process where policies and technology need to align and make it easier for families to apply for services in order to allow them to access all the services that they're eligible for. The reason to do this is because the various programs serve so many of the same families and individuals, but our policies and our application methods don't always align, even where they can. We talked a little bit about peak in particular and how challenging that can be. But also these processes need to account for where technology may not be accessible. So, what can we do to prevent a family from having to go and spend 4 hours in a county services building because they don't have access to technology? What can we do to make this a little bit easier for them as well?
Thanks so much, Danielle. I think that's our whole universe of groups, non-groups, new groups. So I'm going to pass it back to Wei Bing. I'm going to do a little bit of work on the side, see if I can summarize these. But thank you all so much for your participation on that.
Okay, thanks, Carolina. Yeah, thank you for participating. And hopefully that activity started everybody's gears turning in their head. And I think we have already touched on a lot of the kind of main topic areas that we're going to spend the next about half hour talking about. So, and like I said, this is probably not revolutionary information for many of you, but we wanted to just lay some groundwork so that we all have a shared common understanding as we move into our more in-depth conversations. So I might be presenting what seems like pretty simple, basic things. So bear with me. But we wanted to start and just talk briefly about what CAEE is. And I think that's the term Colorado this group is using. We've seen other folks call it just coordinated enrollment. Some people refer to it as CEE, coordinated eligibility enrollment. But I think it's clearly indicating the different pieces of enrollment steps that need to be taken into consideration in order to get a family from showing interest, like the first step of showing interest in a program and having them enrolled and being able to send their kids. So people call it different things and do it different ways, but overall it's a strategy that states and localities can use to build a more robust and interconnected early childhood mixed delivery system. And so I think from where we sit at the national level, it's a systems building strategy, right? It's to try to bridge some of the gaps between services. You all mentioned removing barriers, ease of access for families, so that the different services in this very fragmented early childhood system that we have are better connected with each other. Okay, next slide. So to set the scene a little bit, we wanted to just share some resources with you and to remind folks that this is a process, that there are different localities that are undertaking coordination, but different people do it different ways depending on what the needs are and what the particular services that you're trying to coordinate services are. So this is kind of the high level 30,000 foot up look, so that when we really get into the work of what's it going to look like in Colorado, you have a sense of what it can look like based on what other folks have done. So two main examples of coordinated services that we've come across are in housing and urban development. So HUD has a program called Continuum of Care, which is basically housing services for the homeless. And they mandate coordinated intake for this particular program. It's locally administered, and so it's a federal mandate for local administration. And they actually have an entire suite of resources that you can find at this website that kind of describes how the coordination happens at the local level from their program's perspective. And then we've also seen coordination happen within the MICV program, so maternal, infant, early childhood home visiting, which is part of this larger early childhood mixed delivery system, depending on how your locality is framing the range of early childhood programs that you're considering pulling into your coordinated CAEE system. But within MICV, we've seen that depending on the state, different localities have taken initiatives to coordinate entry into their home visiting programs. And so one of the things that were from where I sit, I've noticed is that there's these different models of coordination, and there's a difference between coordinated intake and entry versus CAEE. And so I think I wanted to bring this distinction to the group so you all can think about it and mull it over as well. So the HUD and MICV models, and you see this kind of with mental health services too sometimes, they use coordinated intake, which usually utilizes a individual who serves as a navigator or some kind of enrollment coordinator. So they are the single point of entry for families. When they show up asking for services, there is a person who can talk with them, work with them, help them fill out their application, and hold their hand through the initial assessment process, and then refer them to what is deemed the appropriate program. So that's a different type of process than CAEE, as we've seen it play out in other localities, which really is a joint creation of enrollment processes done at the program level. So we'll talk more about CAEE, obviously, because I think that's where Colorado probably wants to head. But I just wanted to point out the difference between coordinated intake with a navigator and CAEE being done as cooperation at the program level, because you don't have staff. You know, it's very resource intensive to come up with a CAEE process initially, because you have to work across programs to co-create your enrollment system. But you don't have a staff member, or many staff members in some cases, that you have to continually fund to serve in that navigator position. So from my perspective, it's a more sustainable system for the long term. So I'm also going to take just a couple of minutes, because I know we're probably running a little bit long so far today, to talk about this AMCS report, accessing. Sorry, that is a typo. I just realized it's actually accessing, not assessing. No, I apologize. It is assessing. They're assessing models of coordinated services. This is a report that we just very recently came across that OPRE, the Office of Planning, Research, and Evaluation at the federal government, funded. So they funded some researchers to do a scan of coordinated services models that they could see across the country. And this is across different fields as well. So they're specifically honing in on early care and education, but coordination with other health and human services. And so I wanted to spend a couple of minutes just showing you the different models that they reviewed, or in their review of the models, the different categories that they were putting the models in, I guess, is a better way to summarize that, because I think it's a good framework for us as a group to work from within, to understand that across the country, within states and within localities, lots of people are doing this work, but they're doing it in the way that makes the most sense for their localities. And so it can look very different. And there's commonalities, similar things that each locality has to consider. But what ends up happening is very different. And so as you all in Colorado start diving into the work, I think it's good to remember that this can look very different depending on what the particular needs of a community is. So this, next slide, please. This is just a really quick scan of what the authors of the AMCS report came up with as sort of groupings of types of models. So they came up with 3 different types of state level models. So you can see there's a state vision model, a state framework model, and a state direct services model. And the bullets underneath, and I'm not going to read them to you all, but the bullets underneath are kind of characteristics of those types of models. And you can see that state vision is more of a high level, like the state has an idea of how they want coordination to occur, but really there's a lot of local flexibility, and it's the local jurisdictions that are making decisions, you know, in terms of actual implementation. And I think in the middle, you have state framework, which is where the state is coming up with a guiding framework, but many decisions are still being made at the local level. State direct services is the state is actually involved in coordinating some of the services themselves. Next slide, please. And so the authors of the AMCS report also came up with, where they grouped some of the models they were seeing into 3 local models. So these types of models aren't really being coordinated by the state. They're really happening at a regional or local level. And you can see there's a hub model, there's a regional network with a backbone, and there's a narrow coordination model. So in the hub model, you have a large group of partners, and they're working together to do joint case management. They're co-locating services sometimes. They're trying to use a combined data system. And then you have a regional network with a backbone, where I think what's interesting to me is that in this type of model, the goal is not necessarily to integrate services, it's to orient the partners within the network to have similar outcomes. So there's different goals, I think, for these types of coordination models as well. And then there's a narrow coordination model, which is really like a small group of partners working together to try to coordinate services. And these types of models tend to stem from having some type of grant funding that allows them to do this work. Okay, next slide, please. So that was just a quick, overview of how folks who did this scan of models across the country were thinking of mentally organizing different coordination models. Some of the characteristics of coordination that we have run across in our work at the PDG B5 National Center are what you see on this slide here. And these characteristics are, and why I'm calling them a menu is that they're not necessarily mutually exclusive. You don't have to have any of them. You don't have to you can have one, but not the others. And so they're just things to consider as you all move into thinking about how what you would recommend localities in the state in Colorado do. That some models use this single point of entry as the ideal of what they're working towards. They want families to be able to come to one place and then have access to a whole host of services. And then related to that, but not necessary, is a common application. So you can have a single point of entry, but still ask folks to fill out multiple applications. But the common application tends to be a goal for many of these coordination or localities that undertake coordination, where you come to a single place, you only have to fill out one application to then become eligible for many of these services. We also see no wrong door, which is this one I do think is more mutually exclusive with single point of entry, and it refers to folks being able to come to any particular service in the community and then be referred on to other services that they're also eligible for. And so just because you showed up someplace where you don't qualify or it's not quite what you were looking for doesn't mean that they just send you away. They might say to you like, oh, here's someplace else you might consider going, based on what we understand your needs to be. And no wrong door is often tied together with closed loop referral, which is, referring to the fact that when service providers work with you and then they're not exactly what you're looking for, and they might pass you off to a partner organization, that there's communication amongst the partners to make sure that once the referral has occurred, that you as the client, potential client or service recipient, actually makes it over there and is then enrolled, right? So it's similar to warm handoff. So it's just a more complete system where as the family or the service recipient, you're not having to navigate the system on your own so much. And there's a little bit more support from the system helping you do the navigation. Okay, next slide, please.
Hey, Wei Bing, can I ask
Yeah.
a question?
Sure.
So this is point of process really quickly. I'm noting that the chat messages probably aren't going to show up with the recording. Is that accurate? My chat box says messages are deleted when the messages can only be seen by people in the call and will be deleted when the call ends. And I'm only raising that because I put a content relevant comment in the chat. Anyway, something to figure out for later.
Okay, thanks, Christy. I do think we saved the chat. Hopefully, our team is remembering to save the chat before we close out the call so that we don't lose those messages.
Yeah, and I do think that the messages do stay, but we can also, like with the recording, we can access them, but we can also just copy them over.
Okay, great. But I had two content related comments. One was, and before you moved on to these others, is that are there not also some hybrid models where the alignment of standards and processes does happen at the state level, while a regional or local entity then provides sort of the warm touch or the human face, the navigator role? So it's not sort of an either or, but there's a hybrid approach.
Yeah, and I do think that happens, Chrissy, and I think maybe that's captured under state framework in that AMCS report. I have to say, so the AMCS report, they do use the word preliminary, so this is their first step in, I think, the research field trying to wrap their heads around what's going on in practice in a lot of places. And so they were posing these as preliminary models. And I think that how things are implemented in various localities really does span all of these things. And it's a good preview, because I think one of our key topic areas that we're going to talk about is this idea of like the role of the state versus a region or a hub.
Right.
A region or a locality, and how everybody in some models has some role to play.
Right.
Right. And so, yeah, it is essentially hybrid.
Right. And then my second quick question, and I know this is a little bit chicken or the egg, but the model also is going to depend on which programs and which services you're trying to coordinate. Right. So if it's for example, coordinated application eligibility and enrollment for preschool across CCAP, Head Start, CPP, New Universal Preschool Program, that would have one sort of, that would take us to one pathway of making decisions. But if it's what you sort of described earlier, a much more comprehensive of, you're going to enroll for preschool, but then we're also going to help you figure out if you're also eligible for Medicaid and home visiting. And that's a different than pathway of decisions. So
absolutely.
I'm just sort of curious, like, are we just getting the broad overview right now and then thinking about programs? Are we thinking about programs and then thinking about solution?
Yeah, we are just starting with the high level overview because I think, Christy, you're previewing a lot of the topics that we're going to have to dive into deeply as a group. And the scope of programs that you want to coordinate across is sort of the starting point for everything. Yeah, so that's one of our topic areas. We have 6 kind of main from our work, and there may be more. I think as we work with various states and localities, we learn more as well. And so I think right now, the way Carolina and I have kind of organized this is that we have 6 main topic areas I think that the group will really need to dive into, but there could be fewer, there could be more, depending on where Colorado wants to take things. So, yeah, I think we will get there in just a minute. But this slide is about the benefits of CAEE, and I think honestly, this is preaching to the choir. You know, many folks in this room are you are programmatic folks, and everybody in our activity is really touched on this already. So I'm not going to spend a whole lot of time here, other than to say that other than like families being central to all of this, making the experience easier to families, that there's side benefits for providers, that there's also a systems level benefit I think we see, where when you have a more interconnected system, you're just more resilient to challenges and insults. So what we saw happen with COVID is, it was really devastating to the childcare field for many reasons in early education. And what some of the work that we did at the National Center is we followed up with a number of states, Colorado being one of them. So we talked to Kristen about the early COVID experience in Colorado. We followed up with a number of states to see how COVID impacted their plans for their PDG grant. And I think one of the themes that came out of those conversations is that states that had more coordinated services and systems in place to facilitate coordination, including data systems and relationships built across programs, they were really able to withstand the challenges that COVID presented better. To respond to we have healthcare workers who need to send their kids to childcare, and we don't know which childcare programs are even open anymore. When you have systems in place where communication and data are shared, it really allows you to deal with those challenges more easily. So it's one more reason to coordinate across the field. Okay, next slide, please. Oh, I see there was a hand raised.
That
and I didn't mention
accidental.
Yeah. Oh, no? Okay.
But I was just going to echo that problem that you're alluding to was a massive issue for the state of Colorado during the COVID outbreak, because we don't have enrollment data statewide or operational data for that matter statewide.
Yeah.
Or didn't at the time.
So data systems is another big topic. Data sharing and then data systems. So thank you. And I did want to say, please feel free to ask questions as we go. We do have some question time built in at the end, but we can also address things as they come up if that's preferable to the group. Okay, so implementation of CAEE, I think we touched on this a little bit already, that it being different where you don't necessarily have the navigator who then refers a family or individual to a particular program. Instead, you're trying to coordinate distinct enrollment processes across programs. So you're moving from each program having its own processes to creating joint processes, right? And the different steps that need to be considered, you can see laid out. And I think one of the lessons I've learned from working in different places is that it doesn't have to be all or nothing, that CAEE can be done in this piecemeal process in a way that makes sense for your locality based on the political will, capacity of the staff, the funding that you have. It can be just done stepwise and piecemeal. There is kind of a linear sense to things that, you can't really coordinate the actual enrollment of children if you're not coordinating their eligibility determination or whatnot. But it doesn't have to be this monumental, daunting task that you need to have all the answers to before you at least try to get started. That some folks do start with just coordinating their outreach as a first step. but I do think what happens is that as you move through the process of trying to get to like fully coordinated enrollment, you do need like data sharing and joint data management capacity, which is very challenging for a lot of localities. Okay, so one of the rest of our slides, you'll see these bolded questions, and that's not a question. I just want to say that it's not a question we're trying to answer today. That's the question we're raising as what we'll need to try to answer in our in-depth discussions. So I think the overall question is, what will CAEE look like in Colorado? Next slide, please. Okay, so I alluded to our 6 topic areas. So these are the 6 that we currently use to kind of frame our thinking. You all can decide that this doesn't quite work for you, and you may have other topic areas you want to talk about, but we typically think about scope of coordination, level of implementation, so meaning the roles of local governments and programs and stakeholders, regional stakeholders all up through the state, the relationship building that needs to happen, and like I said, the co-creation of these joint processes that programs then use. And related to that are the data sharing agreements and the MOUs that you need in order to be able to co-manage data, and then the infrastructure that you need in order to manage your data. So we're going to spend a minute diving into each one of these. Next slide, please. Okay, so this, in my mind, is almost the most important, but also the least concrete, I think. But what we've heard talking to a lot of places who've gone down this road is that without trusting relationships built amongst the folks who have to work with each other, it's really difficult to get anywhere, right? So there's actually, I have cited down here a report that is also very recent. Louisiana, and we'll talk more in depth about them later today, but Louisiana's been doing this work for quite some number of years. And so this is actually a lessons learned report that I think folks might find really interesting. And one of the things that people there talk about is, needing to have transparency in all of your conversations. And part of transparency is being willing to share your own data and making decisions collaboratively in order to build trust, right? And so while you do that, you're building a sense of partnership across programs and organizations, and trying to remove some of that sense of competition that we often see where different programs are struggling to get kids to enroll or families to enroll. And so they feel like, oh, well, with the arrival of UPK and the state funding more preschool, our kids are going to get taken from childcare or from Head Start or whatnot. So I think a key question here for this group to consider is what is the best way, or how to best build relationships in your community? How do you foster this collaborative decision-making and building of trust? Next, please. Okay, and I think Carolina is going to take a few of these.
Thanks, Phoebe. Okay, so the scope, Christy alluded to this one earlier. What programs are included in the system? So how big or small do you want to go? And we take a pretty broad view here nationally of what those systems could look like. If we could go to the next slide for 1 second, then I'll come back. So here we're using the Early Childhood Systems Workgroup, I believe that's the right title, diagram of the early childhood system. So we have early learning experiences, health and mental health, family support. So within each of these ovals, these colored ovals, there are many, many programs that could be included and coordinated. So coordination could be across sectors or within several sectors and several programs. Within the context of this group, I think part of what we'll go into, if you could go back a slide, is what will the scope of coordinated application eligibility and enrollment be in Colorado? So that will be that conversation. We have examples of supports of different types of programs listed here that we've seen in our work. Can we go to 2 slides ahead? Thanks. Next is the level of implementation. So I really like the small p in program coordination, the legwork role of where things are happening. So this could be regional, local, and that's where there are questions of what the state role is in that level of implementation. You heard Wei Bing earlier talk about the AMCS report and the different state models. So a state that might have a few guidances for localities is taking a further backseat, or might have very rigid implementation expectations for CAEE. What we'll get to when we dive into this particular topic is I'm going to go ahead and guess that this might be a long discussion for this group in particular, given kind of the task at hand is what is the state role and locality. And one of the things that I would like to emphasize here is that bi-directional relationship too is going to be an important piece for a conversation. So not just what is the state asking localities to do, but how the state might be supporting localities and their information kind of going through back and forth. And next slide, please. Wei Bing, this is you.
Yeah. Oh, and I think there a couple of slides ago, I just I wanted to make the point that an important piece of context, I think. So there's always the local, I think, political will, or kind of what the population is ready for, what the folks at the programs are ready for. I think that's an important context to how this work plays out in different places. But there's also the context of governance, and it was on a previous slide. So I just wanted to mention that one of the things to consider is where these different programs are sitting. And I know in Colorado, you all have like the preschool programs with the State Department of Education, and then you have childcare and other early childhood programs sitting within Office of Early Childhood. And that's very common in many states because of the way early childhood was set up to have multiple agencies involved. And I know you all are moving towards the unified early childhood agency, but I think that's another piece of context to remember as we get into the conversations is how will that impact the way different programs work with each other? And that has a direct implication for data as well, right? So different programs tend to have their data stored in different data systems, and that often goes back to the state agency that they sit with. So I wanted to make that point before we move on. Yeah, and so this piece of data sharing and data infrastructure is intricately tied to the governance that you have in your locality. So I think one of the things that we've seen in our work in other places is that data becomes a really big topic of conversation once folks are on board to trying to do this work. And this is where the devil is really in the details, that there is a need for joint case management data sharing. So at the very basic level, within a locality, you might have a couple of programs like Head Start and State Pre-K and Childcare working together. How do you keep track of the different families coming to you and their information and share it in a way that is confidential and secure, right? And we've seen some folks try to use Google Sheets, and that's generally that doesn't meet data security and confidentiality requirements, but it's easy and it doesn't require a lot of resources because this is like data management is very resource intensive. So I think there's a lot of considerations here. I think one of the benefits of sharing your data, though, is that then you have a big picture look at who you're serving in your area. And we've heard people talk about like data sharing all of a sudden revealed to them which families in their communities they were really missing entirely. Because if you're able to look across your programs and then you look across your population, you can see where the gap is, if there's a gap. But if you sit from within just a single program, you don't know where those other families are because you're assuming they're attending somebody else's program. So I think the key question here is, what will the guidance for data sharing be in Colorado? Next slide, please. And then this leads into data infrastructure. And so, how do you manage the shared case management data? But then is there a higher level of data sharing that you want to implement? And so we've seen some folks just do shared case management, but they don't, and different programs have different reporting requirements, but they report their data into whatever system they would have reported to anyway, and they don't have an integrated data system at the higher level or a longitudinal data system. Some places do, and so it can range, like I said before, from a shared Excel to an early childhood integrated data system, which some states have and other states don't. There's also this idea of, do we just roll all of our data into a joint data system from the get-go using a web portal? So a common application that's online that people use to apply. And so I have very, very rudimentary understanding of PEAK in Colorado. And I know we have some experts in the room, and I'm really hoping that when we get to those conversations, the folks who are the data folks in your state can really speak to how things look. But we know that this is something that a lot of states are either working towards or know that they want to work towards, which is to have a single point of entry common application right on the web so that families can go and apply, and then the data roll right into a data system. So key question, what will the guidance for use of data systems be in Colorado? Next slide, please. And I think this was not we didn't consider this a specific topic amongst the 6 to talk about, but I think this will come up depending on sort of which model you all are gravitating towards in Colorado, or how you're thinking this may play out. And the question is, how does funding come into play? And I'm not talking about funding the coordination effort. That requires funding as well, but the actual funding of programs, and how do you need to blend and braid program funding in order to do CAEE, or is that kind of on the side? And I think that remains to be seen depending on where you all think you're going to go with this. What we have seen is that there are some examples of places that use blended classroom models, where they do need to blend and braid funding because they have the level of coordination is to the point where within a single classroom, they have children who are funded through different program sources. And I personally think this is a really cool model, but it's really complicated. And, and there's advantages. I think rural places where there aren't a lot of programs tend to gravitate in this direction, because you can pull kids from a really large geographic area, have them come to one location and be served, but have different types of funding streams feeding in to that one location so that kids can all be served in the same place. Okay, next slide, please. So we're going to wrap this section up with just some challenges and considerations that we've seen come from our experiences in other places. I think this first one is just around how it requires resources to do all of this work. So right now, a lot of states are using their PDG B5 funding to try to spur some of this, but I think places that have longevity in this area really do try to come up with sustainable funding, potentially through the state, in order to keep this effort going, because you have to pay for staff to meet, to talk to each other, to create those processes, to figure out how to manage those data, and then the data system, if you want to actually pursue building out a data system for this, can be very expensive. And then a second consideration is that with the reporting requirements, I think there's some federal eligibility and reporting requirements that we've heard can become barriers for folks at the state level and at the local level. And you all who are within programs will know this much better than I do, but we've heard this raised as a problem in places. So that's just something to keep in mind, that there's barriers that come from the federal requirements. Okay, next slide, please. So here is just some more high level lessons learned from others that I think you all can consider as you start down the road of thinking about how this will look in Colorado. This last reference, the coordinated enrollment across early care and education settings reference, it's one of those success stories that has a lot of details in it, so that I think it could be really useful for the group to take a look at if you all have the interest. It comes from Kent County in Michigan, and it has a lot of detail around like what they were trying to coordinate, how they did it, and some of the lessons that they've learned that I think probably this one quote of "it's not an overnight fix and not one size fits all," I think it applies to most communities that are trying to do this. Okay. I think next slide is an example. Yep. So I wanted to pause there because we've done a lot of talking, and I think future sessions won't be like this. There'll be a lot more discussion from you all with each other. But before we move into the state examples, were there any other questions folks had, either clarifying or otherwise? Okay. All right. So Carolina.
Thanks. I've seen some really great connections in the chat too, Wei Bing.
Yeah, I'm going to try to read those right now. Thanks.
Okay. Please ask questions. I'm going to go really high level into these two state examples. The first is Louisiana, which has been passed a law in 2012 that led to the creation of their coordinated eligibility and enrollment system. They call it CEE. So a little bit of a change in nomenclature there. The lead agencies that are taking on the work, typically it's by parish, have these tasks. So number one is that there's administrative functions. Two is coordinate class, and number three, although is probably one of their most time-intensive tasks, is to coordinate the enrollment and the state funding application for the community network. The community network is the name for that parish that, or county or community that operates the system. And they really have this end goal in mind of unifying the early childhood system to improve kindergarten readiness. And I think that's really at the center of a lot of the choices that they make. Let me go to the next slide. What that looks like on a practical level from kind of semester to semester is the state will offer guidance to the community network on how to accomplish these things. They might give templates, examples, and there's a recruitment campaign. All of the community networks are doing the coordinated enrollment determination at the same time. The applications are going in, and then there's matching based on preference. So there's a little bit of a triangulation between programs there about what might be the best fit based on family need. Thanks. This is kind of the snapshot of the model in Louisiana. So the scope of their work is within Head Start, public pre-K, and childcare. The community networks do have the ability to decide what programs make sense in their community. So there is a little bit of there's autonomy in some of that decision making. As I mentioned before, the implementation is at the parish level. Most of the grantees in this competitive awarding process are the school districts that operate the public pre-K, but not always. There are several exceptions, and they're termed, or they're called Ready Start networks, which Wei Bing mentioned one of the the report earlier, and community networks. The state is contributing funds, and there's at least one data system that they're using. Can we go ahead for the next slide?
Well, so actually, I think, Carolina, there's not a state level data system that they all have to put their data into, right? But each network has a data system that they use in order to manage their own data.
Yeah, they have a state system that they can access that will help them with the eligibility determination process.
Yes,
that is a clear way to put it. Yeah. I know we have some homework to give out. So Wei Bing, is it okay if I pause here and we can catch up on the state example of Oregon next time so we have time?
Yeah.
And
that's great. Yep. We've got 2 minutes left.
So great. What we're going to have you do in the time between now and the next time we see you, which I think is on August 5th, is we want you to start thinking about some of the things that it's going to take to answer those big bolded questions that Wei Bing and Carolina mentioned in their presentation today. So Kristen, if you'll open the Jamboard, I'll also put thank you, Kristen, for putting the link in the chat. You'll see what we're asking you to do over 6 slides is think about those big questions and then start to answer the 2 key questions underneath, which are what are the things we're going to have to think about and address in order to be able to answer the larger question. So in this case, what is this? The larger question is, what is the scope of CAEEB in Colorado? So we want you to identify the things, the answers that you'll need, the issues that will need to be resolved on the left-hand side. Then also give some thought to what's already in place in your state or at a local level that could facilitate some of the resolution of some of the issues on the left-hand side or answer the larger question. And as you flip through them, you'll notice that there's one for each of the questions that Wei Bing and Carolina brought up today. So if you would not mind taking a little bit of time over the next few weeks to give that some thought, put your Post-it notes up there. What we'll do is we'll be reviewing this information prior to our August 5th meeting, but this will also help us think about how to frame and design the deep digs into each of these topics that we're planning for the subsequent meetings. So that, if you have any questions, you can pop them into the chat or you can ask Kristen and we'll be able to answer them through her. But that is the homework.
So any last questions? And oh, it's 2:30. It's end time. So we'll begin the next one with the review of Oregon. We'll try to put the recording in the shared drive and or in an email, just depending on what technology allows. And the Jamboard will be in the shared drive as well. See you all on August 5th from 1 to 2:30. Thank you.